Well, amid the easing of restrictions in some states around the country, the race continues to find treatments for COVID-19. At least 70 clinical trials for drug treatments are underway in the U.S. and abroad. Joining me now on Skype from New Hampshire is Dr. Jonathan Ettinger, a cardiologist and fellow of the American College of Cardiology. He is also affiliated with many hospitals in Manchester, including Catholic Medical Center. Dr. Ettinger, welcome back to the show. Good to see you.
Hi, thanks for having me again, Tracy.
I know since you were last on the show, there has been more reports of possible connections between COVID-19 and heart attacks. What can you tell us about that?
Well, when people are coming in critically ill with COVID, we're seeing heart attack mimickers. So what we will sometimes see is a presentation that looks like a heart attack but isn't really that. So we're in a difficult situation at that time do we treat them like a heart attack, or do we treat them for the COVID and see how this quote unquote heart attack plays out? Currently, about 40 to 50% of the presentations with heart attacks and people with COVID aren't what we would think of as the typical heart attack. The heart becomes inflamed because of the virus, and that inflammation creates pain, and it creates changes on the EKG, and it creates a laboratory profile, which, as I mentioned, can mimic the heart attack. So it's quite challenging for the cardiologists who are managing these.
Absolutely. What a challenging time indeed. I know there's also been some new studies that show one of the proposed treatments for COVID-19, which received a lot of attention, hydroxychloroquine, used typically as a malaria treatment, may not be safe from everyone. What do we know about its possible effects on the heart?
So hydroxychloroquine for the heart, we know very little about right now in terms of how it treats we know very little about how it treats COVID. There's a number of clinical trials going on right now that are looking at that. The direct effects of the medication on the heart, however, particularly in combination with another drug, an antibiotic called azithromycin, both of those drugs together can create a change in the EKG, which predisposes you to a life-threatening arrhythmia. So we're cautious about using these drugs just off-label without good data behind them because we could cause more harm than good. So currently, as you mentioned, there are a number of clinical trials going on to look at if these are helpful or harmful or somewhere in between.
We don't have much time left, but I know that at last count, there were a little over 1,800 coronavirus cases in New Hampshire. What are you seeing right now in the hospital?
So right now, we had a plateauing of our admissions and then a slight uptick. I think we're starting to see the slowing. With that came some deaths last week as well. So as the admissions start to fade, we see the death rate rise slightly, the death count rather rise. We think that the curve is flattening, and what people are doing from the social distancing and the masking and just being good citizens during this time, we think that's helping. We haven't seen the surge that we anticipated. We, on the flip side, we're concerned because we haven't seen the number of heart attacks, strokes, and other medical conditions that we typically see as well. So we're worried about people staying at home during the pandemic and suffering through what might be non-COVID related illnesses. So there's two concerns there. Yeah.
Well, Dr. Ettinger, thank you so much for joining us. Thank you for sharing your insight, and thank you for all that you do. We really appreciate it. God bless you. Dr. Jonathan Ettinger, thanks again.
Thanks for having me.